Millions of families are living in a crisis because they cannot access health care. Millions of people live in pain, suffering from preventable disease and hardship. Remote Area Medical, RAM, responds to their needs by providing free quality mobile clinics. In less than 12 hours, RAM turns schools, stadiums, jungles and arenas into fully functional medical centers able to provide dental, vision and general medical care to thousands. Families are so desperate for this care that they begin to line up 48 hours before a RAM clinic begins, often sleeping in their cars to make sure they get one of those precious numbers which will ensure them entrance. For many, a remote area medical RAM clinic can mean the difference between life and death, between securing a job and struggling to make ends meet. For some, it means providing for their family and improving their quality of life. And for every person who receives care at a RAM clinic, it means stopping the needless pain and suffering they have to deal with every day. Our mission is fueled by private donors and driven by the power of volunteers. They join forces to support people who have nowhere else to turn. We all face hard times in life and everyone needs a helping hand at some point. RAM extends that helping hand with a mission to provide free quality health care to those in need. RAM works with local partners called community host groups. A community host group gathers resources, rallies sponsors and recruits volunteers on the local level to ensure a successful clinic in their community. RAM works to empower and equip these local partners to fulfill their own mission and purpose. As a result, RAM and communities converge on a shared mission as we roll up our sleeves and address our problems head-on. Together, we can make a difference, and together we can lead hurting people to a better future. As local leaders prepare for the free RAM clinic, they work directly with experienced RAM staff to build effective strategies and address the crisis their community faces. They need to understand the scale of the clinic and what it takes to provide quality care and follow-up. The demands of the clinic include an appropriate venue to facilitate the hundreds and perhaps thousands of potential patients, water and electricity, security, logistical support for patient and volunteer flow, food and lodging, all must be organized, and RAM helps the local community host group to stay on task to achieve our shared objectives. By joining with a community host group, RAM is able to offer a turnkey, comprehensive clinic using millions of dollars worth of mobile units and equipment and a cutting-edge registration system as well as experienced RAM personnel. RAM also shares the burden of cost with the community host group, so the expense of the clinic does not drain local resources. RAM has always worked to bridge gaps in our healthcare system. A person who needs a dentist cannot go to the emergency room to fix their teeth, and a person who needs an optometrist cannot go to a walk-in clinic to get a pair of glasses. Many families cannot afford their insurance deductible. Unfortunately, RAM may be their only source of health care. When a patient comes to a RAM clinic, they may face a long wait in line, but they receive professional medical services and it's free. They meet doctors who want to help them. They meet people who care. When patients leave, their suffering has been eased, their hope has been restored, and their lives have been improved. They often hug volunteers, thanking them for providing what they needed but couldn't afford. Volunteers leave the clinic knowing their help was needed and appreciated, and the experience brings fulfillment and joy to their lives. Remote Area Medical is a pioneer of no-cost healthcare, and we continue to set the pace to create a better and healthier future for the underserved communities in this country. I started RAM to serve those remote areas of the world that have no access to healthcare. But then I discovered that there were millions of impoverished people right here in the United States. So we've become the champion of the sick and the poor and the underserved, in fact the voice of millions of people who simply cannot get the care that they need. So you can become part of something that makes a real difference and help us bring free quality healthcare to millions of children and their families. Please join me on this compassionate journey of hope, and I do trust that I can count on your support. Thank you very much.